A recent pilot study demonstrated ketogenic therapy provides impressive symptom improvement for individuals with bipolar disorder and schizophrenia. But a social media thread recently claimed we need to discount the findings as it could have all been due to weight loss. So what's the story? Is it just weight loss that led to recovery from treatment-resistant serious mental illness? Or is it more related to the physiological state of ketosis? Welcome to Metabolic Mind, a nonprofit initiative of Bazooki Group, transforming the study and treatment of mental disorders by exploring the connection between metabolism and brain health. Thank you for joining us on this journey. For starters, we have a video covering the study in question in more detail. The study was published in Psychiatry Research by Dr. Sethi, a double board-certified physician in psychiatry and obesity medicine. She took 21 patients on standard of care treatment for their schizophrenia or bipolar disorder and started them on a ketogenic diet as part of ketogenic therapy. After 4 months, 100% of the adherent subjects were classified as recovered, with 100% of all subjects improving their psychiatric symptoms. And she also saw dramatic metabolic health improvements and weight loss. Now, on the one hand, because of those findings, we have to agree that based on this study alone, we don't know for sure if the psychiatric benefits were due to the weight loss or due to the ketosis. Since there was no weight loss control group, the study didn't test for that, and nor was it meant to, right? This was meant from the outset to be a single-arm pilot study. So if all we cared about was science, we would have to say, no, we can't prove it, so I guess we can't use it. But I don't know about you. I mean, I care about science a lot, but I also care about people getting better and living their best lives and putting their psychiatric disorders into remission. And for those patients who have done that with ketogenic therapy, I'm not sure they care if it was the weight loss or a ketosis. So let's say for a minute that it was only the weight loss. Well, if ketogenic therapy is an effective and sustainable weight loss solution, then hooray, it's an effective psychiatric treatment. But we should also see the same thing from just counting calories and exercising more, something I'm not sure we see to this degree. Here's the next step. Is there reason to believe it could be the state of ketosis beyond just the weight loss? And the answer there is absolutely. Ketosis has been proven to treat seizures with demonstrated mechanisms of reducing neuroinflammation, increasing GABA, decreasing glutamate in the brain, improving mitochondrial health, providing an alternative fuel source for neurons. And these findings likely don't occur simply by reducing your calories. But here's the good news, right? The scientific community has reacted appropriately, and there are ongoing randomized controlled trials as we speak. We've done videos highlighting some of these trials. And that's how science is done, right? You start with the pilot and feasibility studies and follow that with the larger RCTs. But in the meantime, for those of you who take care of patients, or for those of you who are a patient or a loved one of someone living with a psychiatric condition, what are you supposed to do? Should you discard a potentially life-changing treatment because we don't have a conclusive RCT? Or could you discuss ketogenic therapy with your healthcare team and see if it could have life-changing benefits for you as it had for so many others? So I guess I'd say let's not lose the forest through the trees. Let's encourage research to continue, and let's help people get better and improve their lives. And let's understand a pilot study is a pilot study, right? And further studies are going to build upon it, but we have patients who need treatment now. And what do we do in the meantime? Thank you for watching. We hope that was helpful with maybe a little different perspective. If it was helpful, please like and subscribe, and please share it with anyone else you think might benefit. And of course, please leave us a comment, as we love to hear from you. And please remember, our channel is for informational purposes only. We're not providing individual or group medical or healthcare advice or establishing a provider-patient relationship. Many of the interventions we discuss can have potentially dangerous effects if done without proper supervision. Consult your healthcare provider before changing your lifestyle or medications. In addition, please recognize that people may respond differently to ketosis, and there isn't one recognized universal response. So thank you again for watching. I'm Dr. Bret Scher, and we'll see you here next time at Metabolic Mind, a nonprofit initiative of Bazooki Group.